Do you have high blood pressure? Then avoid these 7 fruits right now. Have you ever felt that sudden pounding in your chest, that throbbing headache that just won't go away, or found yourself feeling dizzy after climbing just a few stairs? If you're one of the millions of Americans living with high blood pressure, you know exactly what I'm talking about. That constant worry every time you check your numbers, watching them climb higher and higher, despite following your doctor's advice to the letter. It can feel like you're fighting a losing battle, can't it? I understand your frustration. After years of working with patients struggling with hypertension, I've discovered something that might surprise you. Some of the very fruits you've been told are healthy might actually be sabotaging your blood pressure control efforts. Yes, you heard that right. Those innocent-looking fruits in your kitchen could be silent contributors to your hypertension. Today, I'm going to share with you 7 specific fruits that people with high blood pressure should avoid completely. This information isn't something you'll typically hear from your doctor during those rushed 15-minute appointments. These insights have helped hundreds of my clients finally gain control over their blood pressure without increasing their medication. Imagine being able to enjoy family gatherings without constantly worrying about your condition, or being able to play with your grandchildren without feeling winded after just a few minutes. This information could be the missing piece in your journey toward better heart health. So stay with me until the end, because what I'm about to share could literally be a lifesaver for you or someone you love. Before we begin, I'd love to know if you or someone close to you struggles with high blood pressure. Drop a comment below sharing your biggest challenge when it comes to managing your blood pressure. And don't forget to subscribe to our channel and hit that notification bell so you never miss our weekly health insights that could transform your well-being.
Let's talk about what's really happening in your body when you have high blood pressure. Your arteries are like pipes carrying blood throughout your body, and when pressure builds up too much, these pipes can become damaged over time. This damage doesn't happen overnight. It's the result of years of small choices adding up, including what you eat and drink every single day. The standard advice you've likely heard countless times includes cutting back on salt, exercising more, and losing weight. While this advice isn't wrong, it's incomplete. What most healthcare providers won't tell you is that certain fruits, despite being packed with vitamins and minerals, can actually work against you if you're battling hypertension. The relationship between diet and blood pressure is complex and highly individualized. This is why some people can eat virtually anything and maintain perfect blood pressure, while others follow every rule in the book and still struggle. The key is understanding your unique body and how specific foods affect your particular situation. Fruits contain natural sugars, certain compounds, and sometimes interact with medications in ways that can send your blood pressure soaring. The good news is that once you identify these problematic fruits, you can make simple swaps that can lead to dramatic improvements in your numbers. Now, you might be thinking, but I thought all fruits were good for me. This is a common misconception. While fruits are generally healthy for most people, those with specific health conditions like hypertension need to be more selective. Let me be clear. I'm not saying you should eliminate all fruits from your diet. In fact, many fruits are excellent for heart health and can help lower blood pressure. What I am saying is that being strategic about which fruits you consume can make a significant difference in your blood pressure management. I want to take a moment to ask you something important. When was the last time a healthcare professional actually sat down with you and explained how different foods specifically affect your blood pressure? Not just general advice about eating healthy, but personalized guidance based on your unique health situation. For most people, the answer is never. Many of my patients tell me they feel like just another number in the healthcare system, rushing through appointments with barely enough time to ask questions, let alone receive thorough explanations. If this sounds familiar, please share your experience in the comments below. Something as simple as, "I've been dealing with hypertension for X years, and my biggest frustration is..." This not only helps me create more relevant content for you, but it also shows others in our community that they're not alone in their struggles. Sometimes just knowing that others are facing similar challenges can provide enormous comfort. Your story might be exactly what someone else needs to hear today to find hope and motivation. Now, let's continue our discussion about the fruits that could be silently affecting your blood pressure.
The first fruit you should approach with caution if you have high blood pressure is grapefruit. This might come as a surprise, since grapefruit is often recommended as part of a healthy diet, and it does have many beneficial properties. However, for those taking certain blood pressure medications, grapefruit can be problematic. Grapefruit contains compounds called furanocoumarins that can interfere with how your body metabolizes several medications, including some commonly prescribed for hypertension. When you eat grapefruit or drink its juice, these compounds inhibit an enzyme in your intestines that normally breaks down certain medications. This can lead to more of the drug entering your bloodstream, essentially creating an overdose effect. The result? Your blood pressure might become dangerously low, or you might experience increased side effects from your medication. Even more concerning is that this interaction doesn't just last for a few hours. The effects can persist for up to 72 hours after consuming grapefruit. If you're taking calcium channel blockers like amlodipine, felodipine, or nifedipine, or if you're on statins to manage your cholesterol alongside your hypertension, it's particularly important to avoid grapefruit. Instead, try enjoying oranges, mandarins, or tangerines, which provide similar nutritional benefits without the medication interactions. What makes this interaction particularly dangerous is that many patients are never properly informed about it by their healthcare providers. In a busy medical practice, these kinds of detailed medication instructions sometimes fall through the cracks, leaving patients vulnerable to potentially serious consequences. Even more concerning is that the grapefruit interaction isn't just limited to a few medications. It affects over 85 different drugs, many of which are commonly prescribed for conditions that often accompany hypertension, such as high cholesterol or heart rhythm abnormalities. For instance, if you're taking simvastatin, Zocor, for cholesterol alongside your blood pressure medication, consuming grapefruit could increase the statin concentration in your bloodstream by up to 10 times the normal level, significantly raising the risk of severe muscle damage or kidney problems. The challenge with grapefruit is that it's not always obvious when it's present in foods and beverages. Many fruit juices are blends that contain grapefruit juice without prominently advertising this fact. Similarly, many breakfast products, desserts, and even some alcoholic beverages may contain grapefruit as an ingredient. This means that careful label reading becomes essential for anyone on medications that interact with grapefruit. If you're at a restaurant or someone else's home where ingredient information isn't readily available, it's always safest to avoid fruit punches, cocktails like the Paloma or Greyhound, which traditionally contain grapefruit, or fruit salads or desserts where the ingredients aren't specified.
The second fruit that hypertension patients should be wary of is canned fruit cocktail. While not a specific fruit itself, these convenient cups and cans are popular in many American households. The problem lies not in the fruit itself, but in what it's packaged with. Most commercial food cocktails come swimming in heavy syrup that's loaded with added sugars. This excessive sugar can lead to weight gain, which is directly linked to increased blood pressure. Additionally, regular consumption of high-sugar foods can lead to insulin resistance and elevated insulin levels, both of which can raise blood pressure over time. What makes canned fruit cocktail particularly deceptive is its health halo. Many people choose it thinking they're making a healthy choice, unaware of the sugar content. A single cup of fruit cocktail in heavy syrup can contain up to 30 grams of sugar, which is more than the American Heart Association recommends consuming in an entire day for women. If you enjoy the convenience of canned fruits, look for varieties packed in water or their own juice without added sugars. Better yet, keep fresh fruit on hand for snacking, or try freezing your own fruit for a convenient option without the hidden sugars. The third fruit that might be affecting your blood pressure is coconut. While technically a drupe, coconut is commonly categorized as a fruit, and its popularity has soared in recent years with the rise of coconut water, coconut milk, and coconut oil. Coconut and its derivatives are high in saturated fats, which have been linked to increased LDL cholesterol levels, potentially contributing to arterial plaque buildup and higher blood pressure. What makes coconut particularly concerning for hypertension patients is its sodium content, especially in processed coconut products. For instance, some brands of coconut water can contain added sodium to enhance flavor. Even a small 8-ounce serving can have up to 45 milligrams of sodium, and if you're drinking larger amounts, this can quickly add up. The coconut meat itself is also relatively high in calories, which can contribute to weight gain if consumed in large quantities. If you're managing hypertension, consider replacing coconut products with heart-healthier alternatives. Instead of coconut water, try infusing regular water with fresh fruits for flavor. Rather than cooking with coconut oil, opt for olive oil, which has been shown to have beneficial effects on blood pressure. And if you enjoy the texture and flavor of coconut in your dishes, try using just a small amount as a garnish rather than as a main ingredient. Fourth on our list is dried fruits, particularly those with added sweeteners or preservatives. Dried apricots, raisins, dates, and prunes might seem like healthy snack options, and they do contain beneficial fiber and nutrients. However, the drying process concentrates their natural sugars, making it easy to consume excessive amounts of sugar and calories without realizing it. The sugar concentration in dried fruits can be problematic for blood pressure in several ways. First, it can contribute to weight gain when consumed in excess. Second, high sugar intake has been associated with increased inflammation in the body, which can damage blood vessels and elevate blood pressure over time. What makes dried fruits particularly tricky is their small size and sweet taste, which can lead to mindless overeating. Just a small handful of dried fruits can contain as much sugar as several pieces of fresh fruit. Additionally, many commercial dried fruit products contain added sugars to enhance sweetness, as well as preservatives like sulfites, which some research suggests may trigger blood pressure spikes in sensitive individuals. If you enjoy dried fruits, look for unsweetened varieties with no added preservatives and be mindful of portion sizes. Alternatively, keep fresh berries, apple slices, or orange segments on hand for snacking, as they provide more volume and water content to help you feel satisfied with less sugar intake.
There's also the issue of glycemic index to consider with dried fruits. Because the sugar is more concentrated and the fiber is often disrupted during the drying process, dried fruits typically have a higher glycemic index than their fresh counterparts. This means they can cause more rapid and significant spikes in blood sugar levels, which can stress your cardiovascular system over time. These blood sugar fluctuations have been linked to inflammation in the blood vessels, potentially contributing to arterial stiffness and reduced elasticity, both of which can worsen hypertension. For individuals who are also managing conditions like diabetes or insulin resistance alongside hypertension, this blood sugar impact becomes even more significant, creating a double burden on their cardiovascular health. It's worth noting that the processing methods used for commercial dried fruits can also introduce problematic compounds. Some dried fruits, particularly brightly colored ones like apricots or peaches, may contain sulfites as preservatives to maintain their appealing color. While most people tolerate sulfites without issue, some individuals experience sensitivity reactions, including temporary blood pressure elevations. Additionally, some dried fruit products undergo processing with oils to prevent sticking, which can add unnecessary fats to what should be a naturally fat-free food. Always check ingredient labels carefully when purchasing dried fruits to ensure you're not inadvertently consuming additives that could affect your blood pressure. The fifth fruit to be cautious about is the banana, which might be surprising since bananas are often recommended for blood pressure control due to their potassium content. While bananas can indeed be beneficial for some people with hypertension, they're not ideal for everyone. Individuals with kidney problems or those taking certain medications may need to limit their potassium intake. When kidneys aren't functioning properly, they cannot remove excess potassium from the blood efficiently, which can lead to a dangerous condition called hyperkalemia. High potassium levels can cause irregular heartbeats and potentially serious cardiac problems. Additionally, some medications commonly prescribed for high blood pressure, such as ACE inhibitors and potassium-sparing diuretics, can cause potassium retention in the body. If you're taking these medications and also consuming high potassium foods, like bananas, your potassium levels could rise to concerning levels. This doesn't mean everyone with hypertension should avoid bananas. Rather, it's about knowing your specific health situation. If you have kidney disease or are taking medications that affect potassium levels,
consult with your healthcare provider about appropriate fruit choices. For those who need to limit potassium, fruits like apples, berries, and grapes can be better options as they provide numerous health benefits with lower potassium content.
The sixth fruit to approach with caution is canned tomatoes, particularly those with added salt. While tomatoes themselves are excellent for heart health due to their lycopene content, the way they're processed and packaged can make them problematic for people with high blood pressure. The majority of canned tomato products, including sauces, pastes, and diced tomatoes, contain significant amounts of added sodium as a preservative and flavor enhancer. A single cup of canned tomato sauce can contain up to 1,000 milligrams of sodium, which is more than half the daily recommended limit for hypertension patients. Sodium causes the body to retain water, increasing blood volume and putting additional pressure on your arterial walls. Over time, this can lead to arterial stiffening and sustained high blood pressure. What makes canned tomatoes particularly challenging is their widespread use in cooking. They form the base of many popular dishes, from pasta sauces to chilies to soups, meaning that without careful label reading, you might be unknowingly consuming large amounts of sodium. If you use tomatoes in your cooking, opt for fresh tomatoes whenever possible. When you need the convenience of canned products, look specifically for low-sodium or no-salt added varieties. You can also rinse regular canned tomatoes under water to remove some of the sodium before using them in your recipes. The seventh and final fruit to be mindful of is fruit juice, even when it's 100% natural with no added sugars. While technically not a whole fruit, fruit juices deserve mention because many people with hypertension consume them as a perceived healthy alternative to sodas and other sweetened beverages. The problem with fruit juice is that it concentrates the sugars from multiple fruits while removing most of the beneficial fiber. This leads to rapid sugar absorption in your bloodstream, potential insulin spikes, and ultimately increased risk of weight gain and metabolic issues that can worsen hypertension. A single 8-ounce glass of apple juice, for instance, contains the sugar equivalent of about 3 whole apples, but without the fiber that would normally slow sugar absorption and help you feel full. This concentrated sugar load can contribute to inflammation and oxidative stress in your blood vessels, potentially exacerbating high blood pressure over time. Additionally, some research suggests that the act of chewing whole fruits triggers important satiety signals that drinking juice simply doesn't provide, making it easier to overconsume calories when they're in liquid form. Instead of fruit juice, eat whole fruits to get the complete package of fiber, vitamins, minerals, and phytonutrients. If you enjoy beverages with flavor, try infusing water with a few slices of fruit, or make smoothies that incorporate the whole fruit along with vegetables for a more balanced option.
Now that we've covered these 7 fruits to approach with caution, I want to emphasize that managing hypertension successfully is about your overall dietary pattern, not just avoiding certain foods. The DASH diet, dietary approaches to stop hypertension, has been scientifically proven to lower blood pressure by emphasizing fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting sodium, added sugars, and unhealthy fats. What's particularly powerful about this approach is that it doesn't just focus on elimination, it emphasizes addition of beneficial foods that can actively help lower your blood pressure. So what fruits are beneficial for hypertension? Berries, including blueberries, strawberries, and raspberries, are excellent choices due to their high antioxidant content and relatively low sugar levels. These antioxidants help protect your blood vessels from damage and improve their function. Citrus fruits like oranges and lemons, not grapefruit if you're on certain medications, provide potassium and vitamin C, which support vascular health. Kiwis are another excellent choice, with research suggesting that eating 2 to 3 kiwis daily may help lower blood pressure. Watermelon contains L-citrulline, an amino acid that may help produce nitric oxide, which relaxes blood vessels and improves blood flow. Beyond fruits, it's important to address other lifestyle factors that impact hypertension. Regular physical activity, stress management techniques like meditation or yoga, adequate sleep, and limiting alcohol consumption all play crucial roles in maintaining healthy blood pressure. Remember that even small changes, when maintained consistently over time, can lead to significant improvements in your health. Start by making 1 or 2 manageable adjustments rather than trying to overhaul your entire lifestyle at once. Let's talk about exercise for a moment, because many of my patients with hypertension express confusion about what kind of physical activity is safe and effective. The good news is that you don't need to become a marathon runner or spend hours in the gym to see benefits. Research shows that just 30 minutes of moderate activity most days of the week can significantly lower your blood pressure. This could be as simple as a brisk walk around your neighborhood, swimming, or even gardening. The key is consistency rather than intensity. If you're currently sedentary, start with just 10 minutes daily and gradually increase your time. Even this modest amount of movement can begin to strengthen your heart, making it more efficient at pumping blood and reducing the pressure on your arterial walls. Stress management is another crucial yet often overlooked component of blood pressure control. When you're stressed, your body produces hormones like cortisol and adrenaline that temporarily raise your blood pressure. For people who experience chronic stress, this temporary spike can eventually lead to sustained high blood pressure. Simple practices like deep breathing exercises, where you inhale slowly through your nose for a count of 4, hold for a count of 2, and exhale through your mouth for a count of 6, can activate your parasympathetic nervous system, helping to lower both your stress levels and blood pressure. Just 5 minutes of this breathing pattern when you feel tense can make a noticeable difference in your numbers. Sleep quality deserves special attention when discussing hypertension management. During normal sleep, your blood pressure naturally dips by about 10 to 20%. This nightly dip is important for cardiovascular health. However, conditions like sleep apnea or simply not getting enough hours of quality sleep can prevent this natural drop from occurring, contributing to hypertension over time. Aim for 7 to 8 hours of uninterrupted sleep each night. Create a relaxing bedtime routine by dimming lights an hour before bed, avoiding screens that emit blue light, and keeping your bedroom cool, dark, and quiet. If you suspect you might have sleep apnea, which is characterized by loud snoring and periods where you seem to stop breathing during sleep, talk to your doctor about getting evaluated, as treating this condition can have a significant positive impact on your blood pressure. Regarding alcohol consumption, the relationship with blood pressure follows what scientists call a J-curve. Small amounts, such as 1 glass of red wine with dinner, may actually have some protective cardiovascular effects for some people. However, exceeding moderate drinking guidelines can significantly raise blood pressure. For those managing hypertension, it's generally recommended to limit alcohol to no more than 1 drink daily for women and 2 for men, with at least 2 alcohol-free days per week. If you're taking blood pressure medications, be particularly cautious, as alcohol can interact with many of these drugs, either enhancing or diminishing their effects, potentially leading to dangerous blood pressure fluctuations.
Another aspect of lifestyle management that doesn't receive enough attention is hydration. Proper fluid intake helps maintain the proper balance of electrolytes like sodium and potassium, which play crucial roles in blood pressure regulation. When you're dehydrated, your body activates mechanisms to retain water, which can increase blood volume and consequently raise blood pressure. Aim to drink enough water so that your urine is pale yellow throughout the day. While individual needs vary, a general guideline is about 8 to 10 cups daily, with more needed during hot weather or physical activity. Water is the optimal choice for hydration, but herbal teas can also contribute to your fluid intake without adding caffeine, which can temporarily spike blood pressure in sensitive individuals. If you've stayed with me until this point, I know you're serious about taking control of your blood pressure and overall health. Living with hypertension can be challenging, filled with medication adjustments, dietary restrictions, and constant monitoring that can sometimes feel overwhelming. I want you to know that you're not alone on this journey.
Our channel was created specifically to support people like you who are seeking practical, evidence-based information to manage chronic health conditions effectively and naturally whenever possible. Each week, we share new discoveries about managing blood pressure, heart-healthy recipes that actually taste good, and answer questions that many doctors simply don't have time to address during short appointments. If you found value in today's information, please consider subscribing to our channel and turning on notifications. This simple action helps us reach more people who could benefit from this knowledge, and it ensures you won't miss any of our upcoming content that might be exactly what you need to hear. I don't promise miracle cures or quick fixes, but I do commit to providing honest, well-researched information based on current science and real-world experience. Your heart health journey is a marathon, not a sprint, and having the right information and support along the way can make all the difference. Thank you for investing this time in your health today. Remember, every small positive choice you make for your heart adds up over time, creating a foundation for better health and more energy to enjoy the people and activities you love. I look forward to continuing this conversation in our next video, where we'll explore more strategies to help you thrive despite hypertension. Until then, be kind to your heart, because every beat matters. I want to leave you with one final thought that I share with all my patients. The goal of managing your blood pressure isn't just about achieving a certain number on a monitor. It's about reclaiming the quality of life that hypertension can steal from you. When your blood pressure is well controlled, you're not just reducing your risk of future health problems, you're immediately giving yourself more energy, better cognitive function, improved mood, and greater capacity to engage fully in the activities and relationships that bring meaning to your life. Every time you choose a heart-healthy option, whether it's swapping out a problematic fruit for a better alternative, taking a short walk after dinner instead of settling onto the couch, or practicing 5 minutes of deep breathing when you feel stressed, you're making a powerful statement that your health and well-being matter. You're worth the effort that these changes require. Many people find it helpful to keep a simple journal tracking both their blood pressure readings and the lifestyle choices they're making. This creates a tangible record of your progress and helps you identify patterns between specific foods, activities, or stressors and your blood pressure readings. You might discover, for example, that even though bananas are generally considered beneficial for blood pressure, they actually cause your personal readings to increase, or that 10 minutes of gardening in the morning sets you up for better numbers throughout the entire day. This kind of personalized insight is invaluable because it acknowledges what many healthcare providers often miss, that each person's body responds uniquely to different interventions. What works perfectly for someone else might not work for you, and that's completely normal. Trust your experience and the data you collect about your own body while still following your doctor's medical advice.